Hello, and welcome to the Wellness Center Creators Podcast. I like to start each episode by sharing a bit about my favorite practice management software, Jane. We've used Jane at Vancouver Wellness Studio for 3 years now, and we love how intuitive it is, that it's beautifully designed and fun to use, and that the Jane team is invested in our story as a small business. That last part is really key for me and for us here at VWS. The Jane team feels like they're here with us and part of our staff. Their phone and email support, as well as their self-led guides, were incredible resources as we got started and added new team members. And years in, we can still call and email them for help. We've never been left in the dark on how to edit something, make a change, or simply ask a question. Like starting any business, there are investment decisions you need to make about where to put your dollars. Jane made it easy for us to say, yes, this is a smart business decision. When we saw that we'd have unlimited support, that the cost of Jane felt fair and fit within our budget, and that we'd be able to have a say in features and how the software grows, we were in. It changes everything when you use a software and work with a team that cares about your journey. That in turn helps us feel confident booking clients in, processing payments, and helping our own customers grow. If you want to get started with Jane, you can head on over to jane.app. From there, you can book a one-on-one demo to see Jane in action. Or if you know you're ready to get started, mention the Wellness Center Creators Podcast for a 1-month grace period applied to your new Jane account. As health and wellness providers, we know that better patient outcomes require a whole person, multidisciplinary approach that we just can't provide on our own. That's why I've started the Wellness Center Creators Podcast. I'll be bringing you interviews with experts, tips, tricks, secrets, resources, systems, and solutions so that you don't have to reinvent the wheel. And creating your wellness center won't feel like starting over. Welcome back, everyone, to the Wellness Center Creators Podcast. Today on the show, we have Dr. Suzie Bergman. Dr. Suzie is a devoted dental practitioner and educator, passionate about improving healthcare outcomes for patients by treating the whole person and forming multidisciplinary teams. She is involved in clinical care, dental and medical education, research, infrastructure, and advocacy for patients suffering from orofacial pain disorders such as TMD. Welcome, Dr. Suzie.
Hi, Kendall. Thank you so much for having me today.
We're so glad to have you. So I love your approach to healthcare in general and dental care. And I'm really curious to start with what led you to start using that approach. What issues were you seeing? What experiences were you seeing with patients that made you want to create a different experience for them?
That's a great question. So I see a lot of patients who are coming to me after they've seen other providers for complex facial pain problems. A lot of these patients have what we call TMD, which you hear others referring to as TMJ, but problems with their jaw joint and the way that the muscles surrounding those joints are working. And so a big problem that I have seen for years is that oftentimes, patients will only seek treatment once they have a chief complaint that has risen to such a level that it's a problem in their life. So, depending on where that patient lands, they may end up seeking out care for headaches and see a neurologist, or they may start out saying, my teeth or my jaw hurt, I need to go see my dentist. Or they could say, I have pain in my ear and they see the ENT. But the truth is that these types of disorders affect all of those areas. And so it's really unfortunate sometimes when a patient goes to a provider who doesn't know a lot about these disorders and they can actually get a diagnosis that's not accurate. We see a lot of patients who are diagnosed with something like trigeminal neuralgia, which is very, very rare. And it's actually a TMD that they're suffering from. But by the time they get the accurate diagnosis, they've already had treatment for something that they didn't actually need.
It's an all too common experience and story, right?
Yeah.
And that leads me to my next question about, what are the benefits of a multidisciplinary approach? And any of my business coaching clients and our listeners hear me talk about multidisciplinary teams often. And I'm really curious what you've seen as the benefit to patients and to your team members.
So I always like to share a quote that kind of opened my eyes to this issue. And I'll just tell you the quote. Unfortunately, I don't know who said it, so I can't attribute to the genius who said this. But the quote is, "Natural law did not divide man into three parts: dental, medical, and psychological. If society chose this division for the purpose of healthcare delivery, then each professional group bears a special responsibility to be sufficiently informed about the others so that integrated total healthcare is an achievable goal." And so for me, that's kind of the crux of why I do things in a somewhat unconventional manner. I try to get patients to realize that, yes, if you have headaches and jaw pain all the time, it interferes with your sleep. And when you don't sleep well, this can lead to some mood alterations. And all of the things that you're experiencing are connected to each other. So we need to stop having silos in our healthcare that prevent us from treating the patients in a manner that would benefit them more.
And why do you think more providers haven't adopted this model?
Well, the first dental school started in the 1800s. I don't remember about exactly which year, but at that time, this artificial division began where patients were told you go to one type of provider for your mouth, you go to another type of provider for the other parts of your body. And at that time, what started to happen was that our healthcare records became separated. Our ability to communicate with providers involves a lot of time on the part of the person trying to form a multidisciplinary team. And time is very valuable. And so a lot of providers just don't have a way to make this practical for them in their practices. And then our healthcare system needs people who are innovative and kind of have a disruptor culture mentality, who say, let's try to bring things back to what's important, which is the patient, instead of just saying, well, this is the way we've always done things, so we have to do it this way.
Exactly. Exactly. So, how can patients help themselves, right? How can patients be advocates for themselves with regard to their overall health and wellness and really considering their dental health in this? Because we are absolutely taught in our culture that dental is completely separate, which
Right.
is silly. I mean, it's really silly. And so I think this is so, so important. So how do you feel that patients can really advocate for themselves?
So I think that it's very important that patients go through proper avenues. I always like to remind them that Dr. Google isn't really their friend and it's not the place to find your answers, but there are ways that patients can educate themselves so that they learn what it means to treat the whole body and the mind at the same time, and then look for providers who are willing to do that. And that the patients also find ways that they feel they have control. Because when a patient is in a lot of pain, the patients that I see have been usually suffering with pain for years, if not months. They have kind of been given the message that they just have to sit with it, they go to someone who says, well, I don't see anything wrong with you. I'm not finding a reason for this. Maybe you just need to relax. Maybe you should take up yoga and
Yeah.
that kind of thing. But really, the human brain was designed for problem solving. So we don't have to just sit with it. And what I like to teach my patients is behavioral modifications. And I also like for them to do things like journaling. It's a really good practice to make kind of a pain diary or a wellness journal, whatever term they want to use, so that they're checking in several times a day and then answering some questions like, what is something that filled you with enthusiasm today? What is something that drained you today? What is something that you learned about yourself and your condition? Like, I exercised so rigorously that I caused my symptoms to be greater. Or today I asked someone if they would pick my kids up from school so that I could just take a few minutes to care for myself. And those are the things I think that patients can learn that will help them feel like they have some control.
That's beautiful. And I'm so glad to know that you exist. I'm so glad to know that you're here in our community working in this way, because it's really interesting, because we see those same types of patients at our clinic here, and to know that there is a provider in our community with a originally dental approach, and now doing whole person healthcare and teaching, really helping patients develop a different relationship to their pain and their illness and their body, and to help empower our community to advocate for themselves in healthcare and know that there is a better way and there's a different way. And I just love that you're here and doing this.
Thank you. I'm happy to be here.
Hey there, this is Katie from the Jane team. If you're brand new to the name, Jane is a practice management software designed to be helpful to you, no matter where or how you practice. Here at Jane, we talk often about the amazing practitioners we get to work with. That's you. We have a growing community of like-minded practitioners who are constantly sharing ideas and their experiences with Jane, especially in our Jane Community Forum. This is a great spot where you can connect with fellow Jane users and other allied health professionals to share tips, insights, and support as you build, run, and grow your business. Just search jane.app Community Forum on Facebook, and you'll be prompted to answer a few questions before joining. With that being said, if you're curious about who Jane is and what we're all about, this is your invitation to chat with our team. Head on over to jane.app to do just that. And if you're ready to sign up, you can mention the Wellness Center Creators Podcast for a 1-month grace period applied to your new account.
So, what do you hope an integrated approach to health and well-being will do for the future of healthcare?
Well, I'm really hopeful. I'm involved in a lot of educational projects, and I'm also going to be starting a multidisciplinary center that's going to be a model where we'll have residents from the different disciplines coming in and doing rotations so that they can see how this really gives our patients better overall outcomes. And I think one of the things that I am optimistic about is that the pandemic helped us really recognize how easily we can communicate across centers, across institutions. We have this ability to make our communities larger by tapping into the wisdom of other people that we know who may be in a different state or in a different country. And all of us who kind of have this like minded approach can help move things in our communities in a different direction.
That's beautiful. I can't wait to see the development of your center and just see it come to fruition.
Thanks, Kendall.
So, you have a giveaway you want to share with our listeners.
Yes. So my partner, who is a speech language pathologist and an oral myologist, has a clinic in Portland, and she and her husband sell these products that are called Dial Pure. And Dial Pure is CBD that is safe, consistently pure, and derived from citrus terpenes. So it doesn't contain any hemp or cannabis or THC. And they have several different types of products. Some of them are in the form of a pain relief cream. They have daily support tinctures. They have tropical fruit and mixed fruit gummies, and then they have a product that helps with sleep. So I would like to offer the listeners an opportunity to purchase something for 30% off the retail price, and hope that they find some benefit from it like I have.
And how can the listeners find you and purchase those products?
So the products can be ordered directly from dialpure.com, www.dialpure.com. Or actually, what they would do is find the product there that they would like to purchase, and then they can contact my office so we can give them the discount of 30%. And my office phone number is 360-693-9349. And I also have a website, dentistryonofficersrow.com. And we are present on Facebook and Instagram as Dentistry on Officers Row.
Great. And I know you also have a cookbook coming out, and you wanted to be clear, it's not quite finished yet, but if you want to tell the listeners a little bit about that.
Sure. So I'm actually working with Madison from Vancouver Wellness, who is a nutritionist, and she is amazing. She and I have known each other for several years, and she was working as an assistant for me and still kind of does some things for me with regards to the nutrition piece of overall health and wellness. And this cookbook is going to be for people who have had any types of oral surgery or jaw surgery, or maybe they just have severe restrictions in their chewing ability because of TMJ pain. And so it's going to not just be a cookbook full of smoothie recipes, it's going to actually give the customers ideas about what types of foods are good for reducing inflammation, what types of foods will support their healing, and what things they should avoid and the reasons for that. And then it's also going to have a section that shows them some great kitchen tools that they can use to make their food prep easier.
Sounds amazing. I can't wait for it to be finished.
Me too.
Thank you so much for being here, Dr. Suzie.
It was my pleasure, and it's nice to, I've been to your Vancouver Wellness studio several times. It's nice to meet you in person finally.
Talk to you soon.
Okay, take care.
Thanks so much for listening to the Wellness Center Creators Podcast. I hope you enjoyed the episode. Please visit our website at wellnesscentercreators.com for more show notes and additional episodes. Plus, if you do have time, please subscribe to the podcast and please consider rating and reviewing the show. That will help other people find us. Thanks again for listening, and we'll catch you next time on the Wellness Center Creators Podcast.